the problem with the tax code and health insurance is that the government allows employers to provide health insurance to their employees on a tax-free basis, where the money comes out before tax. Therefore, employees prefer to be compensated in the form of health insurance rather than wages as money, because if they get money, they're going to have to pay taxes on it. So there's a built-in preference for insurance, and as a result, we have an overutilization of insurance. People use insurance for things that they ordinarily wouldn't use insurance for. In general, you want insurance for low probability, high cost things. Major medical. Something happens that you get cancer, you get hit by a car. You have major expenses. You don't want to use insurance when you get the flu, if you sprain your ankle. These are things that are routine medical care that people should have ample savings to pay for. But because of the tax code, they would rather have a very low deductible policy where they have these low copays because they perceive it as something they're getting without a tax. Whereas if they got paid money instead, they would probably be much more conservative in the health care that they purchase, because they would be purchasing it with after-tax money. And also the other problem is now all of a sudden we've got this whole system where health insurance is now coming through your employer. So if you lose your job, you lose your health insurance. It would be much better if individuals were able to buy their own health insurance and take it with them regardless of where they happen to work. And this would happen if we change the tax code. And there's two ways to do that. Either you can tax health care benefits and then lower the income tax on everybody, or increase the personal deduction so that people don't have higher taxes to pay. But now they have the money, they have more money in their pocket, and they can decide, to buy health insurance or not, or what kind of insurance they want. Or you can give people, a tax-exempt income with which they can either have the cash or buy health insurance. That would be the equivalent of getting it from your employer. But either way, you want to get the taxes out of it so there is no distortion. And then if that happens, and of course, if you get the government to stop the states from making it illegal for individuals to shop, throughout the country for insurance, instead of just allowing certain insurance companies to offer insurance within the state. If you had a lot of companies competing for business and you had Americans buying their own health insurance, then we wouldn't have the cost running out of control. It's one of the reasons it's so expensive, is because there's so much overutilization. And of course, when the employers are buying the health insurance, they're not as concerned about it because it's not even their money. It's their employees' money in many cases. Sure, they pay for it, but they pay for it by paying their employees lower wages. People think it's some kind of free benefit. But if your employer is going to provide you health insurance, that means he has to take it out of the wages that he would have paid you if he wasn't paying you health insurance. And of course, the health insurance costs go up. I have insurance for my employees, and the costs are up, I think, 16% this year. Every year they go up, 10 to 20%. But if we took the insurance out of the employment process, I think insurance would be a lot cheaper, and then medical procedures would be a lot cheaper, because you wouldn't have people overusing the healthcare system because they would perceive a cost. Right now, when you have people with insurance for everything, they don't really care if a third party is paying for it. No one really cares what it costs. But if the individual is paying for it himself, and if taxes were lower because you got rid of that preference, he'd have more money to afford it. But there'd be more competition. People would be shopping, because if you look at the medical procedures that happen outside the insurance system, take a look at eye LASIK surgery, for example. The costs of that procedure have been coming down year after year after year because insurance is not involved. Individuals pay for that out of pocket, so they shop around. They try to find the doctor who will do it for the lowest cost. And the doctors know this, so the doctors have to compete with one another because they know that you can shop around. You'll see the same thing in other procedures like cosmetic surgery, where costs are flat to falling over time, because again, in general, you can't get insurance to cover cosmetic surgery. There are some rare circumstances, but in most cases, if you're going to get breast implants, you're going to pay for them. And so women shop around, and they look for a good deal. And the doctors know this, and the doctors have to be competitive. So the more that we can introduce market forces back into the healthcare system, and the more we can get the government out of it, the less expensive healthcare is going to be. I mean, it's not an accident that healthcare costs are rising at such a rapid rate. It's because the government is involved. I mean, everything the government is involved in, you have costs running out of control. Look at the education. Look at how much tuitions go up. This is not an accident. It's because government is involved. Government highly subsidizes because they guarantee loans for people to borrow money to pay tuitions. But if you look at the areas where government is not involved, I mean, government is not involved in personal computers. They're not involved in cell phones. Yet the prices are falling. If the government was involved, the prices wouldn't be falling. I mean, they can easily rationalize it by saying, well, of course computer prices are going up. Look how much more sophisticated they are. Look how much more powerful they are. How could the prices not go up? They make the same arguments with education or health insurance. Well, they say health insurance, well, it's so much more complicated. We have so much better procedures. If there was no government involved, I'm sure healthcare costs would be falling. Just like other costs are falling in the economy, because the free market is the best mechanism for driving costs down. I mean, that's what happens. The only reason that prices don't fall sometimes is because the government creates a lot of inflation. But absent government-created inflation, markets are going to drive costs down. And it would be no different for healthcare if we simply let the market function and got the government out of the way. Unfortunately, what we're doing now is we're getting the government more involved. And so we're just going to exacerbate this situation where we're going to drive healthcare costs even further by increased government involvement, and ultimately we're going to drive quality a lot lower.